Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Back, everybody. Dr. Tom Wallace joins us today with St. Vincent Heart Clinic, Arkansas. It's the last day of Heart Month, so we wanted to talk a little bit more about your heart's health and talking today about sudden cardiac arrest and some of the devices that can help with that. It's good to have you, Dr.
Thanks for
Wallace.
having me.
First of all, let's kind of talk about your specialty and what that means for the heart.
Right. So I'm a cardiologist that specializes in heart rhythm disturbances, and our title is a cardiac electrophysiologist. So we specialize in taking care of patients who have abnormal fast heart rhythms or slow heart rhythms, patients who are at risk of having sudden cardiac death. We implant defibrillators and pacemakers.
There are many different kinds of defibrillators. I think we've all seen, you know, the external kind that we can use.
Right.
That's the type of defibrillator.
Right. The AED that you'll see at football stadiums or at airports are designed to be placed on a patient if they're found unconscious, and it will evaluate what their heart rhythm is. If they're having a life-threatening rhythm, it will charge up and deliver a shock to rescue them.
Okay. But the devices we're really talking about today are implanted inside the patient.
Right.
Yeah. Tell us how that works.
Well, for over 2 decades, we've had defibrillators that have been implanted within the body that are able to recognize life-threatening heart rhythms and shock the patient out of them if they have one. The original ones were, and this is an example of the most recent one, which is what's called a subcutaneous ICD. This is the first of its kind. It's a defibrillator that is implanted underneath the skin, underneath the armpit, and then a wire here, and this is an example, that does not go within the heart, but rather on the outside of the chest wall just underneath the skin. So up to now, we've had wires that are actually implanted inside the heart, inside the blood vessels, go through the heart valves and implanted within the chambers of the heart. Those can get infected, they can break, they can damage the heart valve itself. Now we have the option of having a device where the wires sit on the outside of the heart. So the risk of infection is lower. If there is a problem with the wire, we can take it out without damaging the heart. It's an exciting new development.
Yeah, you said we've had these for 20 years and they continue to get better and easier on the patient, I guess.
Exactly.
Yeah, yeah. You were saying this would be especially good for younger patients, perhaps?
Right. A younger patient who doesn't require pacing, but rather just needs a defibrillator to rescue them from a rhythm if they need it. Because the wires they will have a medical device for their whole life. It's best to be able to keep any hardware out of the heart as long as possible. Also, patients who are at high risk for infection may benefit from this, or patients who have difficult with vascular access. They don't have good veins that allow us to get the wires into their heart from the inside. So we can put it on.
We got a good shot of the one he has. Let's hold that up. So this is the part that is implanted where?
Right. And it goes underneath the left armpit here. And then this is sewn in just underneath the skin and sits just next to the sternum underneath the skin here. And the electrical voltage, the shock, it goes from the wire to the can back here and will defibrillate the heart if it goes into a life-threatening rhythm.
It's amazing, isn't it?
It's wonderful.
Yeah, so this is monitoring the patient's heart rate, and then it's set at a certain rate to know when it needs to deliver a shock.
So we can set it to say if the heart rate gets higher than 200 beats a minute, it will charge and then deliver a shock to rescue that patient from that rhythm.
Yeah. If someone you know, thinks maybe they are a candidate for this or need this, what sort of you know, tests would you put them through first?
Well, if someone has already had a life-threatening heart rhythm event, they are a candidate. If someone is at high risk of having one, such as someone with a weak heart muscle, has had a heart attack in the past with a weak heart pump, or have other family history of life-threatening heart rhythm abnormalities, those patients should be screened and evaluated to see if they're a candidate for this.
And this is usually for someone who gets the fast heart rate, or their devices for a slow heart rate too.
Those are pacemakers. This does not pace the heart. That's one of the limitations, is that it doesn't have a pacing function. So if a patient does need pacing as well as a defibrillator, they don't qualify for this. But if they don't need pacing and they just need to have a device to rescue them from a life-threatening rhythm should they go into one, this is a very good option.
It is exciting, and the devices get better. They get less intrusive as well. The procedure is easier, like you said.
Absolutely.
All great news, and we want to remind everybody, of course, about St. Vincent Heart Clinic. If you feel that you need to be set up with a doctor there, you have any other questions about defibrillators or any of the other procedures there, you can always give them a call. St. Vincent Heart Clinic, Arkansas, 255-6000 is the number. Thank you, Dr. Wallace.
Well,
thank you for bringing in show and tell today
Absolutely. Thank you
to
for
show
having
us
me.
how it works. It's